Imagine waking up one day and realizing that the person you love, their humor, their warmth, their spark, has started to fade. They don't remember things quite like they used to. Their personality seems off, not because they've changed, but because their brain has. Dementia doesn't happen overnight. It's a slow, silent thief, stealing small pieces of a person years before an actual diagnosis. And here's the scary part. The earliest signs are often overlooked, brushed off as stress, aging, or just one of those things. You may have heard about Bruce Willis's recent diagnosis with frontotemporal dementia, FTD. His story has shed light on how dementia isn't just about memory loss. It can impact personality, language, and behavior too. And it can start far earlier than most people realize. The truth is, dementia can start affecting the brain up to 10 to 15 years before a diagnosis. But if you know what to look for, you can catch it early and take steps to slow its progression. So, what are these warning signs? Some may surprise you. If someone in your life has been acting differently lately, this video might give you the answers you need. Stick around. When most people hear the word dementia, they immediately think of memory loss, like forgetting names, dates, or where you left your keys. But frontotemporal dementia, FTD, is different. Instead of memory problems, FTD affects personality, behavior, and communication first. So, imagine this. Someone who's always been friendly and outgoing suddenly becomes cold and distant. A responsible parent or spouse starts making reckless decisions. A person who used to have perfect manners now says inappropriate things out of nowhere. That's FTD in action. It doesn't take away what you remember right away. It changes who you are. It strikes earlier than you think, unlike Alzheimer's, which usually affects older adults. FTD can hit people as early as their 40s or 50s, right in the middle of their careers and family life. This makes it even more devastating because it's happening when people should be at their peak, not struggling with a disease that changes their personality, often misdiagnosed as something else. Here's the tricky part. FTD doesn't look like dementia at first. It's often mistaken for depression, anxiety, or even a midlife crisis. Think about it. If someone starts withdrawing from social life or acting out of character, people assume it's stress or burnout. Even doctors sometimes miss it. That means people go years without the right diagnosis. Why early diagnosis matters now? There's no cure for FTD yet, but catching it early makes a huge difference. Families can plan, manage symptoms better, and prepare for what's ahead. Most importantly, it gives loved ones the chance to understand that the person's behavior isn't them changing on purpose. It's the disease. If someone you know has been acting differently, losing their filter, showing unusual behavior, or struggling with speech, it's worth paying attention. It might not be just stress or aging. It could be something bigger. Now let's discuss the 10 early warning signs of FTD. 1. Personality changes. One of the first and most confusing signs of frontotemporal dementia, FTD, is a sudden shift in personality. This isn't just a midlife change or occasional mood swings. It's a person acting completely out of character in ways that feel unsettling. Imagine a naturally shy person suddenly becoming loud and overly social, striking up deep conversations with strangers, or oversharing personal details. Or picture a kind, patient parent who unexpectedly starts making rude, unfiltered comments without any remorse. These behaviors can be baffling, and at first, they might seem like stress, aging, or just an off day. The truth is, these changes aren't intentional. FTD affects the part of the brain that controls behavior and emotions, causing people to lose their filter and social awareness. They don't realize they're acting differently, but the people around them do. Since these personality changes don't resemble typical dementia symptoms, like memory loss, they're often mistaken for depression, anxiety, or even a sudden personality shift. Many families and even doctors misinterpret these early warning signs, delaying proper diagnosis. But if the behavior is persistent and completely out of character, it's worth paying attention. If a loved one is acting strangely, becoming impulsive, inappropriate, or aggressive when they never were before, it's important to take note. Watch for other unusual behaviors, and if the changes continue, seek medical advice. If someone's personality seems to be changing for no clear reason, don't ignore it. It could be an early warning sign of FTD. 2. Loss of empathy. A sudden loss of empathy can be one of the most confusing signs of frontotemporal dementia. Someone who was once caring and compassionate might start reacting in ways that seem cold or inappropriate, like laughing at bad news or showing no concern when a loved one is upset. Imagine telling them about a tough day, expecting comfort, but instead, they just shrug or change the subject. It's easy to assume they're being rude or insensitive, but the truth is, this isn't a choice. They're not doing it on purpose. FTD affects the part of the brain responsible for understanding and responding to emotions, making it harder for them to recognize when someone is upset or react in a socially appropriate way. It's not that they've stopped loving or caring. Their brain just isn't processing emotions the way it used to. If you start noticing these changes in someone close to you, especially if they're happening alongside other unusual behaviors, it might be time to take a closer look. 3. Socially inappropriate behavior. One of the toughest and most embarrassing signs of FTD is a sudden shift in social behavior. Someone who was always polite and well-mannered might start saying offensive things, making inappropriate jokes, or acting in ways that completely disregard social norms. Imagine being out in public with a loved one who suddenly insults a stranger, blurts out something inappropriate, or starts acting in a way that makes everyone uncomfortable. It's shocking, and as a family member, it can leave you feeling embarrassed, confused, or even frustrated. But here's the thing. They're not doing it on purpose. FTD damages the part of the brain that controls impulse control and social awareness, meaning the person doesn't recognize that what they're saying or doing is offensive. Loved ones often try to explain or apologize for their behavior, but it can be emotionally draining. If someone close to you is suddenly acting inappropriately without realizing it, it's not just a personality change. It could be an early sign of FTD. 4. Poor judgment and decision-making. One of the more alarming signs of frontotemporal dementia is a sudden decline in judgment and decision-making. Someone who was once careful with money might start making reckless purchases, giving away large sums to strangers, or falling for obvious scams. Imagine a loved one who never splurged suddenly maxing out credit cards on things they don't need, or wiring money to a scammer who convinced them of a fake emergency. It's heartbreaking, and it can put their financial security at serious risk. The worst part? They don't realize they're making bad decisions because FTD affects the part of the brain responsible for logical thinking and risk assessment. That's why families need to step in early, before serious financial damage is done. If you notice unusual spending habits, impulsive financial choices, or a lack of awareness about consequences, it's time to have a conversation and put safeguards in place. 5. Apathy and loss of interest. Apathy is one of the most subtle yet telling signs of frontotemporal dementia, and it's often mistaken for depression. But here's the key difference. With depression, people usually feel sad or hopeless, while with FTD, they don't seem to feel anything at all. Someone who once loved gardening, painting, or spending time with friends might suddenly lose all interest, not because they're upset, but because they just don't care anymore. They stop making plans, ignore hobbies they once enjoyed, and withdraw from social interactions, not out of sadness, but out of indifference. It can be frustrating for loved ones who try to encourage them, only to be met with blank stares or passive agreement that never leads to action. If someone close to you seems to be checking out of life, losing interest in everything without showing signs of sadness, it could be more than just a phase. It might be an early sign of FTD. 6. Repetitive or compulsive behaviors. Ever notice someone doing the same thing over and over, lining up objects just right, tapping surfaces a certain number of times, or sticking to a rigid daily routine with zero flexibility? With frontotemporal dementia, these repetitive or compulsive behaviors aren't just quirks or personal preferences. They're symptoms of the disease. The brain struggles with adaptability, making routines feel necessary rather than optional. If something disrupts their pattern, say a favorite mug is moved or a daily walk is skipped, it can lead to frustration, even full-blown agitation. To them, it's not just an inconvenience. It's as if the world suddenly feels wrong. This can be tough for family members who may not understand why simple changes cause such distress. But recognizing that this behavior isn't a choice, it's a sign of FTD, can help loved ones approach the situation with patience instead of frustration. 7. Changes in eating habits. Have you noticed someone suddenly eating way more than usual, craving sweets non-stop, or even forgetting to eat altogether? FTD can seriously mess with a person's appetite and food preferences. Someone who used to eat a balanced diet might start binging on junk food, constantly reaching for sugary snacks, or eating the same thing meal after meal. On the flip side, they might also forget to eat entirely, skipping meals without realizing it. This isn't just a case of a sweet tooth getting out of hand. It's the brain losing its ability to regulate hunger and cravings. The best way to manage this? Structured meal plans can help maintain balance, and keeping tempting but unhealthy foods out of reach might curb overindulgence. If meal skipping becomes an issue, gentle reminders or set eating schedules can help ensure they're getting the nutrition they need. 8. Difficulty with complex tasks. At first, it might just seem like small mistakes, struggling to balance a checkbook, messing up a familiar recipe, or taking longer to complete work tasks. But over time, these slip-ups become more frequent and noticeable. FTD can make once simple activities feel overwhelming, especially anything that requires planning, problem-solving, or multiple steps. This often shows up at work first, missing deadlines, making unusual errors, or having trouble keeping up with tasks that used to be second nature. At home, it might look like getting confused while cooking, mismanaging bills, or abandoning projects halfway through. If someone you know is suddenly having trouble with things they've always handled with ease, it's worth paying attention. Offering step-by-step guidance, simplifying tasks, or lending a hand with important decisions can make a big difference as they navigate these changes. 9. Language problems. Ever had a word right on the tip of your tongue but just couldn't get it out? Now imagine that happening all the time. People with FTD often struggle with language in ways that go beyond the occasional forgetfulness. They might have trouble finding the right words, start speaking less and less, or even use completely incorrect words without realizing it, like calling a spoon a chair. This can be frustrating, both for them and for the people around them. The key? Patience. Rushing or correcting them too harshly can cause even more frustration. Instead, try slowing down, using simple sentences, or finding other ways to communicate, like gestures or writing things down. It's not about forcing perfect speech. It's about making sure they still feel heard and understood. 10. Lack of self-awareness. One of the toughest parts of frontotemporal dementia is that the person experiencing it often doesn't realize anything is wrong. They might brush off concerns, insist they're fine, or even get defensive if someone suggests seeing a doctor. It's not stubbornness. It's the disease affecting their self-awareness. This can make getting help tricky, but a direct approach usually isn't the best strategy. Instead of saying, "You need to see a doctor because something's wrong," try framing it around overall health. Let's get a checkup to make sure everything's okay. Bringing in a trusted doctor, friend, or family member for support can also help ease resistance. The goal isn't to force them into care. It's to gently guide them toward the help they need. Why early diagnosis matters and what to do next. If you're noticing unusual changes in a loved one, whether it's personality shifts, poor judgment, or language difficulties, don't ignore it. While these signs can be subtle at first, getting an early diagnosis is key to understanding what's really happening and planning for the future. See a specialist. The first step? Talk to a doctor, preferably a neurologist or dementia specialist. General practitioners might overlook frontotemporal dementia, FTD, because it doesn't always start with memory loss like Alzheimer's. A specialist can run cognitive tests, brain scans, and evaluations to pinpoint the cause of the changes. The sooner you get answers, the sooner you can start managing symptoms. Managing symptoms and finding support. There's no cure for FTD yet, but that doesn't mean there's no help. Speech therapy can assist with language problems, and occupational therapy can provide strategies for daily tasks. Support groups, both for those diagnosed and their caregivers, offer invaluable guidance and emotional support. Small lifestyle changes, like structured routines and meal plans, can also make a big difference in maintaining quality of life. Caregivers need support. Caring for someone with FTD can be overwhelming, and it's easy to put your own needs last. But self-care isn't selfish. It's necessary. Seeking respite care, joining a caregiver support group, or simply taking breaks when possible can help prevent burnout. Remember, you can't pour from an empty cup. If you suspect FTD, don't wait. Early diagnosis gives families time to prepare, access resources, and most importantly, understand that these changes aren't personal. It's the disease. With the right support, both patients and caregivers can navigate this journey with greater clarity and compassion. Recognizing the early signs of frontotemporal dementia can make a world of difference for both the person experiencing it and their loved ones. These changes aren't just quirks or personality shifts. They could be signs of something bigger. The sooner FTD is identified, the sooner families can get the right support and plan for the road ahead. Have you noticed any of these signs in someone you know? Drop a comment below. Your experience could help others going through the same thing. And if you found this video helpful, share it to spread awareness and subscribe for more health insights. Let's keep the conversation going.